Yes, sir. Mike Dobbins. Here. Keith Austin. Here. Harley Buzzard. Sean Crittenden. Joe Deere. Kanan Duncan. Rex Jordan. Darrell Legg. Here. Wes Snowfire. Dora Petzkowski. Here. Mary Baker Shaw. Connie. E.O. Smith. Here. Janice Taylor. Here. Victoria Vesquez. We have a quorum.
Thanks, Shelley. Well, moving down to reports, we're going to be hearing from Ms. Lisa Pivick, our Senior Director of Public Health, and Dr. Dan Gann, the Medical Director of Public Health. Go ahead, Lisa.
Good morning. It is very nice to see all of you in person once again. It's been a year. Can you hear me?
I can.
It's on. Okay. It's really nice to see you. Your report is in your packet. It was a rather lengthy report for this month with a lot of attachments, and I don't have a presentation necessarily for the public health alone infrastructure portion, but I wanted to highlight a couple of things. You do know that we're doing reaccreditation right now. That happens every 5 years, and so there's a lot of infrastructure work that has to get done to be reaccredited. If you'll remember, we were the first tribe in the United States to earn public health accreditation, and as of now, there are only 3 total in the United States that are accredited. So that requires us to do a lot of work that we put off during the COVID epidemic, which is still going on. We completed our strategic plan, and I put that in the packet for you to peruse and take a look at and ask any questions. That plan is the inward-facing plan. We are in the process of doing the Tribal Health Assessment and Tribal Health Improvement Plan, which is the community-facing plan for public health, and we'll be sharing that with you as soon as we finish that. Other items of interest, the Male Seminary Recreation Center is open as it was, and it is back to normal operating hours, and that is Monday through Friday from 5 a.m. until 9, Saturday and Sunday 8 to 5. Strict mitigation measures are still going on. All masking must be done while you're in the facility at all times. They have messages going out every 30 minutes. The trainers are trained to make sure that there are not too many people in one room at one time. And we are really happy with being able to get some people back out. And luckily it's summer, so we can do a lot of things outside in a safer manner. Actually, I think that's about all I have, unless there are specific questions about content in the report. I'm very happy to answer that.
Questions for Ms. Pivick? Keith? Okay. We'll go Keith first, then Harley. Yeah.
Lisa, you've got the wing schedule in here. I've had people in my community ask me about how do we get involved in the wings race? You know, local organizations that would like to partner. Mm-hmm. Can you help me understand that a little better?
Sure. We actually put the wing schedule together in December of every year, and we base it on that feedback from different communities and the public health educators that work in those clinical locations, in those clinics, and the community organizations that they've been working with. So the best method is to get either with myself or Jeff Tucker, who is over all the public health educators, and give us the name of a community organization that's interested. As you notice, we only have 12 races this year. Next year, we're hoping to go back to our normal number of races, so there'll be more opportunities for communities to get involved in that way.
Thank you.
Mm-hmm. Harley?
Lisa, I have a couple of questions. I don't know, maybe not questions, but the first one is, you said there were 3 organizations, and I saw one of them with 7 directions. What's the other one? I couldn't find it again.
Actually, public health accreditation is only issued to sovereign tribal governments, and the 3 that are accredited are us, Cherokee Nation, and there are 2 in Wisconsin, the Oneida Tribe and Forest County Potawatomi, and that is due to Wisconsin's very active effort from the state of Wisconsin to get tribes accredited and their participation with those tribes in that area.
I see. The other, I think, well, maybe it is a question. My wife suffered a brain bleed. And we've been to doctors with her, and she wanted to report it to the CDC as what she thinks happens. We talked to the neurosurgeon, and he doesn't want to hear what she thinks happened to her. What we've done so far is reported it to the Veneta Clinic, and they did take the information and report it to the CDC. I guess what we want to do is make sure the CDC does get that information, because, and I know there's not enough research on it to make a comment on it from doctors, I suppose. So, but anyway, just an example of what happened. A nurse had called her and asked her how she was getting along, and she told her what happened and stuff like that. And then the nurse said, well, you're the second person that told me that they had the same situation that you had. So she said, so, you know, there's not enough research on it, but I just want to make sure that it's reported to CDC. And the reason I say that is because you see on Facebook, of course, I know a lot of things aren't what they're supposed to be, but a lot of that stuff's been reporting, but I hadn't seen any of this stuff about a brain bleed. So I just want to make sure that, that something is written down someplace about it, so other people can make those choices of what kind of vaccine they want to get. So
Okay.
anyway, if you would check on it just to make sure that's in. If you have any questions, you can call me and we could talk about it later.
Sure, absolutely. I'll reach out to the Office of Tribal Support at CDC.
Okay, thank you.
Okay, yes. Daryl?
Hey, Lisa.
Hi.
So I got a gym in Salisaw. It's the Highway 64 gym. They have a training for youth that are obese, and they were wanting to know if Cherokee Nation could help pay for memberships for kids that could not afford it, or work out some kind of an arrangement to where, you know, kids that were just with no other means of income or support could get some help going through their training program. And if you could, I'd just like to talk to you about it later.
Okay,
Thank you.
that'd be fine. Thank you.
Counselor Shaw, did you have a question?
Yes, Lisa, could you please share with us whether or not we're still doing contact tracing, and when, consider an approximation and when it will be okay for us to sit in council chambers right by each other?
Okay, thank you. Those are great questions. Yes, we are still doing contact tracing and case investigations. We continue with that. And this is one of the most important times to be doing that, because this is an excellent way. Contact tracing works best when we can contain the virus and we can catch it when there's low numbers and prevent the spread. As far as the question about being able to be in person, Dr. Gann is going to do a full presentation on COVID, and he may have a little more answers to that. What I would say is we're not there yet, and a lot of it depends on making sure we get everyone vaccinated and get our communities safer before we can do that.
I appreciate your response. Thank you.
Thank you.
Is this where we want to bring Dr. Gann in? Is this,
Sure.
that work? Okay.
Good morning, everyone. It sure is nice to see your faces. So, well, half of them, anyway. So we're just going to go through a few slides. Overall, COVID-19 in Northeast Oklahoma and Cherokee Nation is at a low level, but it's still spreading. But we're going to start. I think we're going to start. There we go. So globally, cases are starting to slow down. You can see we've peaked at a higher level than we were back in December and January. Globally, India is the main driver. It is a total apocalypse there. The urban centers, a city like Delhi has the same population as California and Texas combined, and they're completely overwhelmed. So we're sending, they're receiving international assistance now, and simple things like oxygen and IVs and things like that. But most of the world is has peaked and gotten better. And we won't go through all the countries, but this is just kind of the top 25 for the number of cases reported yesterday. You can see the in the column you want to look at is this weekly case change. So they're comparing the number of cases in the last 7 days to the previous 7 days. You can see India is still increasing, 32% change. And then Colombia in South America at 7%, and then Japan. Japan's still at a really low level, not very many cases. But you see the other larger countries, the cases are decreasing, so going in the right direction. And just a map of the world, you can see South America still has a lot of countries in the red, but all the countries are improving except for Colombia. And then Central Europe was in really bad shape for the last month, and that's starting to improve. India is still in the orange because they have 1.4 billion people, so their number of cases per 100,000 still doesn't put them in the red zone. And the other red countries you see there in Europe and the Middle East are improving, so getting better. Now, the United States, finally, after over a month of a slow increase, we're starting to decrease. The average number of cases now is 59,000 cases per day. And it's kind of hard to intellectualize that, but you think about it, that every day there are 59,000 people who caught COVID, right? New ones. And that's what it was yesterday and the day before that and the day before that. So the virus is still out there and people are catching it and spreading it to others. But improving, it's good to see. And the map of the United States is looking much better. Oklahoma is actually in the yellow. This map is from the Harvard Global Health Institute, and for some reason they have some different data. I don't know where they get it. Oklahoma is in the yellow. All eyes right now are on Oregon and Washington State. Their numbers are still in the orange, but they're two of the states that are increasing. Now in Oklahoma, you can see how the curve has flattened. The orange line on the graph is the 7-day moving average of number of cases. And we're hanging right around 240, 250 cases per day. And that's been steady for a while. The Oklahoma data is still somewhat unreliable. In the evenings, they report what percentage of cases they reported that day were more than 2 weeks old. That means those people who had tested positive are now recovered. And it varies anywhere from 5% to 20%. But it's the best data that we have, and it looks pretty stable. Now, there's all kinds of maps out there for the United States and for Oklahoma and for the counties in Oklahoma. And the three main groups we look at all have different ways to color code their maps. So CDC looks at the number of cases per 100,000 total in the last 7 days. The Oklahoma State School Board Association looks at the 7-day moving average, and they have their orange category split in two, and then red is more than 50. Then the Oklahoma State Department of Health kind of stops at orange unless our hospitals get overwhelmed, then they go to red. So with that being said, this is the Oklahoma State School Board Association map that was put out yesterday, and it covers data through last Saturday. And they use data that's reported by the state health department. In the upper left corner is what things look like last week, and then the bigger map is this week. So things are looking better. There's more green, less orange, and a lot of yellow. And these are the data that the school superintendents use to determine what mitigation measures are necessary in their schools. So it's looking good. Now, this is a CDC map, and again, this is a number of cases in the last 7 days. The upper left-hand corner is actually 2 weeks ago, and the larger map is what was published yesterday. So 2 weeks ago, the area around Oklahoma City was in pretty bad shape, and now that's gone to yellow and orange. You can see northeast Oklahoma. Ottawa County just has these periodic outbreaks that they're trying to control. But the rest of northeast Oklahoma hasn't looked as good for a long time. But the virus is still out there, and it's still spreading from person to person. And so we watch very closely the bed occupancy in Tulsa and in Oklahoma total. And you can see for the last many weeks, it's been between 200 and 225. That's really good. The percent availability varies from 12 to 14% for intensive care unit beds and anywhere from 12 to 20% of the regular medical surgical beds. So our hospital systems are in good shape in Oklahoma. In Tulsa, you can see I got concerned when we got down below 40 a couple of weeks ago, then we went back up to 70, but it's holding pretty steady over the last couple of weeks, 50 to 70 patients admitted to the hospital with COVID-19. So our whole goal right now in this part of the epidemic for Cherokee Nation Public Health and our epidemiology department is to keep an eye out for a new surge locally. And the way we do that is by testing. Now, when people get hospitalized with COVID, the average is 7 to 10 days of having symptoms before they're admitted. So relying on the number of people admitted to the hospital to identify that puts us behind quite a bit, 7 to 10 days. So we are keeping close track of the number of cases. The state data just isn't quite reliable enough for us to depend on that. So we're using our local data. This is a map from the CDC where they estimate, based on the number of people with antibodies to COVID that have been infected in the state. And according to the CDC, based on 1,300 samples, 18% of Oklahomans have had COVID-19. Now we try to use this to help us determine the number of people with natural immunity and combine that with the vaccine data to determine the status of the population as a whole, their susceptibility to COVID. But we don't know what percentage of these people who have had COVID are vaccinated, so we just can't add the numbers together. And there's quite a reference range, a confidence interval there. Based on the sample size, the real number is somewhere between 16% and 21%. All right, so Cherokee Nation, our average right now is 5 cases per day. It's gone up in the last couple of days, not significant. We were down between 2 and 4 for many weeks, and just this week it went up a little bit. But the numbers are so low, just one family getting COVID can really bump up that average, so not concerned. This graph goes back to February 15th, and it just kind of helps with the scale. And but every one of these cases is being investigated, and contact tracing is being done. And we're tracking it quickly. So this just pulls out the 7-day moving average of the number of cases. You can see we're at 4.7 today, and it's stayed below 5 since for the last month and a half. And here's the number of cases per week. It kind of helps put it together. Looking at cases day by day, they go up and down so much. But you can see for the last 2 months, or month and a half, we've been doing really well. 25, 26, 15 was Easter week, so we didn't do as much testing. And then so far this week, we're up to 19. So this is how we're going to identify a new surge, and it's not happening yet. Now, of course, our whole surveillance system depends on the number of people we get tested, and we're still doing pretty well with that. Almost 2,000 people a week for the last 6 weeks, and we're on track this week to do the same thing. And our positive test rate is another metric we look at. If you can see here, at the worst of the epidemic, 25% of the people getting tested were positive, and we've been below 3% for several months now. So I'm confident that the numbers we are collecting reflect what's happening in our community with COVID-19, meaning that the amount of virus in the community is low, but there's still community transmission. Then the vaccine data, CDC collects data, which includes the military and the VA system and the Indian Health Service. So according to CDC, 29% of Oklahomans have been fully vaccinated, and that's the whole population. That includes the kids that aren't eligible for vaccine now. And then the United States, the estimate is 37.8%. So we're a little bit behind the national average, but moving in the right direction. I haven't kept track of the trends in vaccines too much, but the state EPIs are telling me that the number of people getting vaccinated each week is decreasing. Now, this is really interesting data. This is from the state weekly epidemiology report, and this is the percent of people who are vaccinated. Now, these two maps are for people 16 years and older, and the one on the left is last week, and the one on the right is the one that was reported yesterday, and there's a pretty big jump. We've reached out to the health department. We think the state health department has now incorporated our data into their numbers, and that's why there's a good 4 to 7% jump in each county. So that gives us a little bit better estimate of what we're dealing with. So if you consider, say Craig County, where 35% of the people age 16 and older are vaccinated, and maybe another 10 or 20% might have natural immunity from having caught COVID, that's still quite a few people who are still susceptible to catching coronavirus. And that's why we're still wearing our masks and being careful in public. And here's 65 years and older, our most vulnerable population at risk for severe COVID-19 symptoms and hospitalizations and deaths. Adair County took a nice jump to 32%, and Delaware County is at 44%, Cherokee County at 43%. Craig County is at almost 64%. So it's all very encouraging that our most vulnerable population are getting protected. Yes, sir.
So, back to that other slide, so is that saying 39% of 65 and older of everybody in Sequoia County is vaccinated? Or
Yes.
is that
Yes, sir. This is state data.
non-Cherokee and Cherokee?
Yes, sir.
Okay.
Yep. So when we try to use our Cherokee vaccination numbers to make that estimate, we don't know how many Cherokees or Native Americans are getting vaccinated outside of our system. So we really need to add our numbers to the state data, and the state's now doing that. So, and CDC has done that from the beginning.
Okay.
So we're always concerned about variants, right? And the CDC has a list of what they call variants of concern, and these are they. And then there's variants of interest, where they're watching, they're not sure if they're really more virulent or contagious or deadly. But this is just for reference. CDC publishes this weekly, and each bar covers 2 weeks of data. And you can see the bar on the right, that's for data ending April the 10th. The UK variant, which is the B117, is now the predominant virus in the United States. Whoop. Come on now. There we go. And then the B1429 is from the West Coast, as well as the 427. Biggest concern is the P1 variant. That's the variant from Brazil that they think people who are previously infected were still susceptible to severe disease with that variant. That's why Brazil had such a hard time last month. And that is doubled over the previous reporting period, but it's still only 3.5% of cases in the U.S. So, of course, we'll be watching that closely. Oklahoma has only sequenced 203 people, and the UK variant is at about 28%. And we've only had one case of the P1, which was several months ago, and someone who had traveled to Brazil, and they contained that. It didn't spread. So we'll keep an eye on that. All right, the new CDC guidance that came out 2 days ago, very confusing. And I'm going to go through it with you briefly, and there's going to be lots of questions. But with CDC, you really have to read every word in every line to understand what they're trying to say. And what they're really saying, right, is that if you're immune to COVID-19 because of vaccines, you need to protect that immunity. Every time that I'm exposed to COVID-19, that gives the virus an opportunity to find a way to beat my immune system. And if it succeeds, then I'm going to pass it to someone else who's vaccinated. So it's a risk benefit, right? It's not, if you do this, you will not get COVID, and if you do this, you will get COVID. Some things are just more risky than others. So CDC says this is guidance for people who are vaccinated. That if I'm vaccinated, I can visit with other unvaccinated people indoors without a mask, right? It doesn't mean I can visit with vaccinated people. It's indoors without a mask. It's very specific. Then I can visit unvaccinated people from a single household who are at low risk for severe disease indoors without a mask. It's not that I can visit with people who aren't vaccinated without a mask. It's one household at home, and those people don't have particular risk factors for severe disease, over the age of 65, diabetes, lung disease, obesity, et cetera. And again, this guidance is for social settings. So the confusing one is outdoor activities without a mask except in crowded conditions. What is crowded conditions? There's a basketball game inside a crowded condition. Yes, it's inside and it probably is crowded. If I'm going for a walk on the walking trail, I don't need to wear a mask. I'm passing someone and by myself or I'm with someone else. That's not crowded. So that can be a little difficult to figure out what is crowded and how long and et cetera, et cetera. But think about, again, protecting your immunity and protecting the people who aren't vaccinated. And then no routine testing before or after domestic travel. If you remember the recommendations that if you were going on a trip, that you get tested before you go, and when you come back a few days later, get tested again, and if you become symptomatic in the next week or two, then get tested again. And then if you are vaccinated and you don't have symptoms, you don't need to be tested after you've been exposed. So I'm a teacher, I'm vaccinated, and one of my students tests positive, and I spent time with that student without a mask on. I don't need to get tested. I don't need to quarantine unless I'm having symptoms. Right? If you're having symptoms, then go get tested, and we'll quarantine until we get test results back and see how you do. We've had 3 cases of vaccinated people testing positive and being sick. Right, and that's out of 29,000 that are fully vaccinated, but it happens. Right, the vaccine is 90% effective at preventing you from catching COVID-19, 95% effective at keeping you from getting symptomatic COVID-19, and nearly 100% effective at keeping you out of the hospital, and nearly 100% effective at keeping you from dying. Right, but it's not 100% keeping you from getting COVID-19. But it's there's no other vaccine we have that is as effective as the COVID-19 vaccine for anything. And there's still some recommendations that if you work in a high-risk setting, you should get tested weekly. That doesn't apply to vaccinated people. All right, a little bit more. Hang in there. So vaccinated people should continue that when you're in an indoor public setting, you should still take precautions, meaning mask and distance. Best you can. I think of restaurants, right? Any other large indoor gatherings. If I'm visiting indoors with unvaccinated people at increased risk, then I should wear a mask, right? Even if I'm vaccinated. I should avoid indoor, large-size, in-person gatherings. And even if I'm vaccinated, if I start having COVID-like symptoms, I should get tested. And again, that last bullet point, follow guidance issued by employers. This isn't guidance for employers on how to deal with their workplace, because workplaces vary so much. The nurses at Hastings have a different work environment than the people who work in finance at Cherokee Nation or work, a textile factory somewhere, right? So each place is different. So we have conversations regularly with Cherokee Nation leadership on Cherokee Nation policies for the workplace on COVID-19 mitigation. And, there's nothing in this new guidance that says we should change what we're doing at Cherokee Nation, protect our employees and the people that we serve. And that is it.
Questions for Dr. Gann? Keith?
The percent of people vaccinated, you said it's 30-something
Yes, sir.
population. Does that include children? Are children taken into that, under 16, are they taken into that total population?
Right, so the CDC map that I showed, CDC data, the denominator is the total population, so everybody. The state data will say, the two maps that I showed there, 16 and older and 65 and older.
Okay.
So the 29% is total population of Oklahoma. So the kids are included in that.
Okay.
Kids that aren't eligible to be vaccinated right now.
What portion of the population is 16 and under?
I don't know. Yeah.
I just think that's important information in that total number because
Sure.
those people, we can't offer that to yet.
Right.
So,
Yeah, I think from an epidemiologic point of view, I'm interested on if someone is not vaccinated, then they're susceptible and can spread it more easily, even though we can't vaccinate them now. So for our vaccine efforts, we want to know what percent of the people who are eligible have we vaccinated, and the state data shows that.
well, just from the standpoint of how much of a reach have we had into the communities, it may not show the true pictures, if you're saying 30%, well, if 20% of the, I think it's probably bigger than that, but 16 under, say that's 25% of the population. But we can't even reach that part of the population.
Right.
Then it's like, for determining how many people we could potentially reach,
Right.
we can't reach those people right now
For sure.
through
Sure, it's
vaccination.
difficult. I heard one really disturbing story today when we routinely, as part of our case investigations and contact tracing, we ask people if they're vaccinated. If they say no, we ask them if they have any questions. And one of our contacts told us that they heard that if you got vaccinated, you would lose your health insurance because the vaccine's not approved. And that's just not even close to true. It's so sad. The vaccine is approved. It's approved for emergency use by FDA and the CDC. So it's not an unapproved vaccine. One of the reasons the vaccine was able to reach the emergency use approval so quickly is because there was so much COVID-19 happening that you could get a good number of people exposed to measure it, to see if it worked or not. If we were doing the same study on maybe measles, where we have 100 or 200 cases a year in the United States, then that takes years to figure out if a new vaccine might be effective. For COVID-19, we're having thousands of new cases in Oklahoma a day. And then when you spread those studies out for the United States and across the planet, it was easy, to see how effective the vaccine worked and determine the immediate safety. The concern is always long-term effects of the vaccine, but the research is coming out now with the long-term effects of COVID-19. Like 60% of people have long-term effects, and Cherokee Nation Health Services is looking for what guidelines are being developed on how to take care of these patients, and they're showing up in our clinics. Still having problems breathing, having problems sleeping, problems with their kidneys, their cognitive function is still impaired months after having COVID-19. So the risks to the vaccine are absolutely minimal. One of the safest vaccines we've ever had, and the most effective we've ever had. It's just a miracle. Really, really is. So fortunate to live in a country with the best scientists on the planet and the availability. Cherokee Nation's offered the vaccine to anyone who shows up. And we've got the people to do it, we've got the skill to do it, and we've got the vaccines in the freezer ready to give them. So really is amazing.
We are offering the vaccine to anybody 16 and over. Are we getting much of that young age group, that 16 to, say, 24-ish type of age group?
Yeah, I don't know the percent for us, for Cherokee Nation, our administration, what percent are that age. The state numbers aren't that impressive. If you look at the weekly epidemiology report the state puts out on Wednesdays, it was like 7%, I think, for that 16 to 18-year-olds. It's pretty low.
Do we have any feeling of, are we getting close to having approval for a portion of the 16
The
and
younger.
under population yet.
Yeah, I haven't kept up with that research. I just hear that, yeah, they're looking at it and the data's coming out. And so what the FDA and CDC are doing is looking at the data as it's coming out. They're not waiting till it's all done to look at it. So I think we're getting close. Rumor went through my shop that it was going to be last week, that, 12 and older were going to be approved, and it didn't happen. So,
Okay.
but yeah, hopefully soon.
Well, that sounds like
Yeah,
close, is all we
yeah,
can say.
close.
Counselor Crittenden.
Thank you, Dr. Gann. My question's really for Lisa, I believe, when that time comes. I don't want to get in front of anybody that had some for Dr. Gann, though.
Dr. Gann, if you were to look at a graph of influenza this last flu season, you showed the trend with COVID, obviously, and we've been preoccupied with that. But we've lived with influenza every winter, every year. How would this year's graph of influenza look? Do you have any idea?
I do. The state still sends out a weekly report on influenza, and there was virtually no influenza. Just, 1 or 2 cases here and there, just a handful of hospitalizations, and the line is flat. And when they send out their information, they put the previous 2 years, and, the last 2 years from December to February, it goes up and it comes back down. And this year, it was just flat as a board, going straight across.
What would you attribute that to?
There's
wearing-
2 things. Dr. Mira and I, our infectious disease doctor, discussed this on occasion. Number one is all the mitigation efforts for COVID apply to influenza as well. And the second thing is that the body rarely will get infected by 2 viruses at once. So if you have COVID, you're not going to get the flu.
Because you mentioned the 90% success rate with the COVID vaccine, but flu vaccination success sometimes is in the 30s.
Right.
And so I'm not sure we could attribute the low flu incident this year to the vaccine that was available. It's
Yeah.
probably just due to the mitigation efforts with COVID.
Yes,
Would you agree?
Yeah, and it's, the influenza virus is so different from the coronavirus, the way it mutates and is spread. So, most likely it's the mitigation efforts for COVID worked with the flu too. The effectiveness of the vaccine this year for influenza, we won't know, right? Because there are so few cases, so we won't really know.
Yeah, okay. Harley?
I'm just curious, Dr. Gann, and you may have given the percentage on it a while ago, but is there a percentage of people that are 65 and over that's got the shots? Is there a percentage of people that's under 65? And do you have it broken down somewhere?
Yes, sir. Let me put that slide back up for you. So here is 65 and older. Oh, it's not showing, is it? Hold on. Here, this button. So this is age 16 years and older, and the percentages there by each county are the percentage of those people who have been vaccinated, completely vaccinated.
I can't see those numbers.
Sorry. So Delaware County's at 23.4%.
65 or
16. And then 65, Delaware County's at 44.2%.
Okay. Okay. Do you have a running total about the Cherokee Nation, those percentage of the whole Cherokee Nation of 14 counties?
We don't, because,
You'd have to add them all up, I think.
yeah, a lot of our citizens might be getting vaccinated outside of our system,
I see.
so,
Okay, all right, thank you.
yes, sir.
Any other questions for Dr. Gann?
Yeah,
Junior?
why is why do they not report their numbers, LaFleur County?
I didn't quite understand.
LaFleur County, there's
LaFleur.
never any numbers on them, how come?
I just
That's
took a
two of our
section of the
counties, I just
map.
wondered.
I'm not even sure where LaFleur County is.
Just south of Sequoia,
Oh, okay. I just didn't include that in my little cutout of the map. The state epidemiology report shows the whole state and the county numbers. I can get that to you.
okay, no, but
Yes, sir.
Okay, Lisa, I think Dr. Critton had a question.
Lisa, let me just say thank you for your report. And I think it would be better if maybe you and Todd got together before I asked the question I was going to ask.
Okay.
It's just something small, but thank you guys for that. Thank you, Doc.
Lisa, could you inform the counselors what they may anticipate in the future? We sat down and went over my district, you might say, what they may expect to see in the near future.
Yes, absolutely. As you might remember, Dr. Dobbins requested, and we talked about a county profile for all of you with all of the information that we have, both quantitative, qualitative. We finished that template for that and did the Muskogee County profile. Dr. Dobbins reviewed it and felt positive that it would be a good amount of information, that was a good template to use. So now our epidemiology team is conducting that, putting together profiles for each of your areas. And we should have those fairly quickly, now that we have the template together.
Thank you, Lisa. Any other questions? Very good. Thank you, Lisa. Thank you, Dr. Gann, for coming. Appreciate it. Looking on the agenda, old business, none pending, new business, none pending. Any announcements other than the next meeting tentatively scheduled Thursday, June 24th at 11 a.m.? I would entertain a motion to adjourn. This hereby adjourned.